So the next section that we'll explore is morbidity on dairy farms. With all the emphasis around antimicrobial use and subsequent antimicrobial resistance, I think this is a really important area that veterinarians can tackle. If we think about how common morbidity is on dairy farms, again, it is quite common. This isn't Canadian data because we really don't have good Canadian information on these levels of disease. So this is from the US and the USDA NOMS work. And what they found was that about 22% of calves have diarrhea in the pre-wean period, about 12.5% of calves have pneumonia during the pre-wean period, and 3% of calves have naval infections. If you look at the post-weaning period, about 1% of calves have diarrhea, and 5% of calves have pneumonia. So quite common that many calves get treated for disease. If you look at treatment with antibiotics, which is really where we want to focus on ensuring that we have prudent antimicrobial use, we can see that about 75% of calves with diarrhea get treated with antibiotics. And I think that's a really big area that we can educate producers on when to appropriately use antibiotics. Majority of cows get treated with antibiotics for pneumonia, which makes sense, and same with naval infections. So diarrhea is a really big focus on where we can have, discussion with producers about prudent antimicrobial use. If you look at some of the antibiotics that are used for treatment, again, this is from the USDA, so not totally applicable to Canada, but we have many, category 1 antimicrobials like ceftiofur and fluoroquinolone that are commonly used to treat diarrhea. So again, I think there's some other reasonable options like trimethoprim sulfa that we can use to really treat diarrhea well. If you look at pneumonia, majority of producers use fluorophenocal and use macrolides, which again are not of high importance to human health, suggesting that we're having fairly good antibiotic choices in pneumonia treatment. So how can we monitor disease on farms? I think using treatment records is really ideal, but many of the farms that I've seen or been on really don't have great records for treatments. An indirect way that you can monitor is using dispensing of veterinary products and really see if they have high levels, of fluorophenocal that they're using during a certain period of time that might alert you to an issue occurring on the farm. But that's really a indirect way to monitor it. One of the other ways you could do it is using examination at using a standardized health exam, maybe at Herd Health with one of your technicians using this Calf Health Score app. And this Calf Health Score app is a really great way that we can use ensure that our health exams are standardized. It evaluates the nasal discharge, ocular discharge, ear, attitude, cough, temperature, fecal score, navel, and joint. So it really is a whole kind of gamut that you'd want to examine on a calf. And you also can export all this information into an Excel spreadsheet so you can monitor the results over time. So again, another indirect way, but at least every 2 weeks you're monitoring what's happening on that farm. So again, one of the most common diseases that we see in dairy calves is diarrhea. And I think it's one way that we can or one thing that we can educate producers on and how to appropriately identify them and also how to appropriately treat them. So identifying calves with diarrhea, it's fairly straightforward, as you can see from this picture, ensuring that or identifying them that they have a fecal score of 2 or a fecal score of 3 is considered to be abnormal. You also want to look at their attitude because a lot of signs of depression in diuretic calves may help to identify dehydration. And then for dehydration levels, so evaluating the skin tint, looking at eye recession can be really important to really identify what we should do with this calf. Should we give it oral electrolytes, or do we need to give intravenous fluid therapy when they're over 8% dehydrated? Temperature is also another important thing to look at, so greater than 39.5 degrees Celsius, and we'll talk about that in a sec. So when we look at treatment, really fluid therapy is absolute importance. It's the most critical thing that we can do to manage a diuretic case. And really oral electrolytes are really the hallmark of treating diarrhea. And they're really indicated in any calf that shows signs of diarrhea. They don't necessarily have to be dehydrated, but if they have the ongoing losses, they have diarrhea that's occurring, they're losing obviously a tremendous amount of fluid, they're also losing electrolytes. It's really important that we start to provide oral fluid therapy so that we can replace those ongoing losses. There's many different electrolytes that are available on the market, and really the key ingredients to evaluate is sodium. Sodium will help to kind of rebalance some of the electrolytes that's happening in the bloodstream. Glucose will help to with the absorption of sodium that happens. Evaluating the alkalizing agents, whether that's acetate, propionate, or bicarbonate, is important, specifically with bicarbonate, because we don't want to feed electrolyte with bicarbonate immediately after a milk meal because it'll interfere with milk digestion. We also want to evaluate chloride and also potassium. And a good paper that you can look at is this Smith from 2019 or 2009 Vet Clinics of North America paper that looked at the treatment of calf diarrhea, looking at oral fluid therapy. Another question that is often posed is what about milk feeding? Should we continue it when we're providing oral electrolytes? And the answer is yes. Milk feeding should continue in diuretic calves because when you feed that milk continuously, it'll actually improve weight gain. However, it's not beneficial to force feed milk, so only provide milk if the calves are going to drink it. It's also important when we're having that continued milk feeding that we have appropriate timing of electrolyte feeding. Ideally, it's perfect if we could have 4 feedings that are spread out throughout the day. We have 2 with milk and 2 with electrolytes. Going back to those electrolyte ingredients, it's important to look at the alkalizing agents. If we have electrolytes with acetate and propionate, they can be fed immediately after milk feeding. However, if we have electrolytes that contain bicarbonate as their alkalizing agent, we really want to wait 2 to 4 hours after milk feeding. And the reason for that is that it interferes with milk digestion. So it's thought to interfere with the clot formation of the abomasum so that we don't have that proper digestion of milk. So other things for fluid therapy, obviously IV fluids are really important as well when calves are greater than 8% dehydrated. So this is a really simplified chart that you could use with producers. Calf appears standing and strong, just give oral electrolyte solutions. However, if the calf is weak, greater than 8% dehydrated, if it's less than 1 week of age, it doesn't need as high levels of bicarbonate. So typically 5 liters of saline with 250 milliequivalents of bicarbonate added, along with oral electrolyte solution can help. If the calf is greater than 1 week of age, 5 liters of saline with 500 milliequivalents of bicarbonate. If the calf is unable to stand, that calf really does need a high level of bicarbonate. So 5 liters of saline with 500 milliequivalents, and also that continued electrolyte feeding. Additional therapies that you want to provide in a calf with diarrhea are anti-inflammatories. So a study that was done in Guelph used meloxicam and found that using meloxicam in calves with diarrhea led to improved body weight gain. It led to improved hydration score and also improved fecal score, so faster recovery from diarrhea. And a lot of that is driven off of improved consumption of milk, also improved consumption of starter and water, which really helped these calves recover quicker. The final thing to consider is antibiotics. So when you have a calf with diarrhea, not all calves with diarrhea need to be treated with antibiotics. Only about 30% of diuretic calves are going to be bacteremic. So this is a chart that was made by Scott Weiss and Diego Gomez at the University of Guelph, which I think really highlights well when we should be using antibiotics. So if the calf's bright and alert, drinking well, you really just want to monitor demeanor and milk intake while providing oral electrolytes. If they have blood in their stool, it's suggested to go to antimicrobial agents right away. If they're dull, drinking slowly, less than 30% of expected, but they have a fever, antimicrobial agents. If they do not have a fever, just monitor their demeanor. And finally, if they have marked depression, not drinking well, have a fever, antimicrobial agents, and if they don't, monitor demeanor and recheck their temperature within 12 hours. If we switch off to respiratory disease and look at the treatment associated or the identification associated with that, there's many options that we can use to identify calves with respiratory disease, but a lot of them have very differing performances. So just an example here, thoracic ultrasound is really the gold standard in identifying calves with disease. This is thoracic ultrasound here, and what you can see is that we grossly underdiagnose disease if we just rely on thoracic ultrasound alone. If we use clinical scoring charts, like I'll show in a second, those will lead to a little bit of overdiagnosis and a little bit underdiagnosis, but really it's the best thing that we can do when we're educating producers on farm on how to find a calf with pneumonia. So here's a particular chart that's really useful, and it's really not as subjective as some of the other scoring charts that are available. And really it's a score of, normal or abnormal. And there's really, if the calf has a, nasal discharge at any point, it's going to be considered to be abnormal. It also weights some of the different scoring or different criteria differently. So eye discharge only 2, nasal discharge is 4, ear droop or head tilt is 5, and so forth and so on, and takes into consideration the breathing speed as well. And if you add up all the scores together, if the score is greater than or equal to 5, the calf's positive for respiratory disease. So it's really a standardized way in which we can evaluate calves for respiratory disease. It's also an app that you can get on your iPhone or also on your from the Google Play Store. So when treating calves with antibiotics, one of the important considerations that we need to think about is providing antibiotics. And when we're using a standardized scoring system like this one, we know for sure that we need to provide antibiotics when the score is greater than or equal to 5. There's very little work that's gone into looking at the different antibiotic products that we can provide in calves with respiratory disease. So this is one from a feedlot study. And what they found was that there's really very little difference between, fluorophenocal, danrofloxacin, enrofloxacin, or tilthromycin. So they suggested that really any of these products can be efficacious when we're treating respiratory disease. So probably the takeaway from that study is that we really shouldn't be relying on these high category antimicrobials like enrofloxacin and danrofloxacin to treat respiratory disease, especially as a first line, and could be using some of the other products like fluorophenocal, tilthromycin, gamithromycin, and so forth and so on. Also, when we're treating respiratory disease, anti-inflammatory drugs can be offered and do have some substantial benefits. So this is again from a beef study, but they had reduction in rectal temperature, reduced lung consolidation when they provided anti-inflammatory drugs. They don't have, tremendous effects on growth or productivity. They're really inconsistent in the literature, and they do have minimal effects on other clinical signs, but really just that reduction in rectal temperature, making that calf feel better, and also reducing lung consolidation, I think it's justified to provide. So just to wrap up this section on morbidity in calves, again, it happens very commonly. So we have 20% of calves being treated for diarrhea, 12.5% of calves being treated for pneumonia, and 3% of calves being treated for naval infections just in the pre-wean period. So I think as we move into this realm of prudent antimicrobial use, ensuring that we have good calf welfare, I think it's really important that we reduce these levels. And we reduce these levels through some of the stuff that we talked about earlier, good colostrum management, good nutrition, good housing, which can go, again, a long way to reducing the prevalence of those diseases. I also think if you look at, how commonly antibiotics are being used on farm, especially for diarrhea, where 75% of cases of diarrhea are treated with antibiotics, I think there's a room to have a discussion with your producer about prudent antimicrobial use. And following a flowchart that you make where they're only treating them when they, are dull or depressed or clinically affected with diarrhea. Fluid therapy obviously is really important with diarrhea, and providing oral electrolytes as soon as the calves are showing, signs of diarrhea, even if they're still bright and alert, can really prevent some of those negative effects that we see with diarrhea. And finally, for respiratory disease, using some of the clinical scoring charts so that calves are being examined in a standardized way can be really helpful for producers to identify calves with respiratory disease early. So if we combine all those together, I think there's a really big opportunity for veterinarians to talk and discuss about protocols on farm, especially in the pre-weaned area for diarrhea and respiratory disease.